So in this video, I'm going to be going over some practice questions with you guys. So if you need help with answering practice questions and you want to critically, then make sure you stay tuned and watch this video to the end. Okay, so let's get right into it today and let's go through some questions. And I'm going to see if I can maybe zoom in a little bit. Okay. All right, so hopefully that is clear. All right. So what I'm going to hopefully do through this video is help you to better understand how to answer different types of questions. And if you want to actually get this free guide, you can actually click below this video to download these questions right now for free. So the question says, a home health nurse is doing an admissions assessment, part of which includes the risk for falls. Which of the following is the most important factor to consider when assessing this risk? A, how often the patient is ambulatory inside his home. B, whether the patient experienced orthostatic hypertension. C, proper lighting in each room of the home. Or D, if the patient has been diagnosed with diabetes mellitus. So what do you think the answer is? Go ahead, I'll pause for a second and comment below what you think the answer is. Okay. All right. So hopefully you're able to comment and share your answers below. So for this type of question, you got to make sure that you look closely at the keywords. All right. Make sure that you pay closely to the keywords because the keywords is really what's going to make a difference and really help you to better understand what's the best answer. So when it comes to this role, right, of the home health nurse, what it wants to see is that you recognize the role of the home health nurse in this case is to go into the patient's home and evaluate what could make the patient fall in their home, not to evaluate the patient themselves, right? So pretty much all the other choices are about the patient, but C is the only one that addresses the environment. So with this is about you being able to identify what would put the patient's environment at risk. So C is the best answer because especially if you have patients that have poor vision, they're going to have a higher chance of falling, right? Or elderly patients. So for this one, the best answer is going to be C. All right. Hopefully you got that one correct. Comment below if you got it correct. Now the next one says your patient had a complete hysterectomy yesterday. When you enter her room, she is sitting on the side of the bed. Her skin is cold and pale, and she does not respond to verbal stimulation and solely responds to tactile stimulation. What's the first thing you should do? A, assess vital signs. B, call for a crash cart because the patient appears to be near collapse. C, help the patient back to bed. Or D, administer oxygen at 3 liters per nasal cannula. So if you look at this question, what are you immediately thinking? Right? So most of the time, in fact, I'm sorry, let me go ahead and pause for a second. Actually, I will talk, and during this time, you can post your answer or you can stop the video. Most of the time, when people see this question, or sorry, I should say they see the answer choices. If the answer says assess the vitals, they always pick the vitals. And so the reality is that the answer is not always assessing the vitals. You have to honestly be able to look at the keywords, look at everything, and then pick the best answer based on what's going on and not just assume it's always assessing the vitals. So for this one, if you come into the room and the patient is sitting on the bed, they haven't laid on the floor. So if you're thinking, oh no, like They're on the floor, so we can't lift them up, see collar, X-ray or CT scan or something, but they're sitting on the side of the bed. So what we can do is that we can first help the patient back to the bed. That's the first thing. Then from there, I would probably put on the oxygen, and then with the oxygen, then we would, check the vitals, and then if necessary, call the crash cart as well. So this one, the best answer is C. You have to make a point too to stop and kind of like visualize the choices. Like visualize what's going on with the patient in real life, and that will help you to, be able to pick the most appropriate answer. So C is the best answer for this one. All right. Comment. Did you get that right? Comment below if you got it right or wrong. All right. The next one says a 20-year-old patient has been treated for second and third degree burns over 30% of his body. Part of the discharge planning education includes wound care instructions. Which statement made by the patient would lead the nurse to feel that he is ready to be discharged and begin home care? A, I need to keep my wound covered in the wound bandage 24 hours a day. B, if any healed areas break open, I should cover them with a sterile dressing and notify the doctor's office right away. C, if I have a temperature, I can take Tylenol every 4 hours. Or D, I can take sponge baths, but not tub baths because tub baths have unsterile water. So I'll pause for a second and let you think about it. Okay, so for this one, right, we got to be aware of, burn percentages. That's definitely important. But this question, it says it wants to see if you can pick the answer that demonstrates that the patient really truly understands their care and will prevent possible complications associated with, a burn that covers 30% of their body, right? Based on the wound care instructions. So that's the line of thinking that you should be thinking about. So the first one says, I need to keep my wound covered in the wound bandage 24 hours a day. Um, so that means they're not going to check the wound or clean the wound or cover the wound or nothing, right? So that could be okay, but it's not really showing that they truly understand what will prevent, anything wrong from going on. The best answer, let's go to C. C says if I have a temperature, give them Tylenol or take Tylenol. Tylenol is okay. It will treat the fever, but we don't know, what if they have an infection? So that shows that they don't understand, their chances of infection and what to do. And then the sponge baths, I mean, that could be right, but that's not the priority. So B is the best one. If any healed areas open, I should cover them with a sterile dressing and notify the doctor's office right away, right? That's going to be the best answer. All right, then the next one says a nurse is teaching health safety to new employees who work dietary and instructs the new employees on the importance of proper hand washing to prevent toileting. So we have A, spread. Is it going to be A, the spread of AIDS, B, the spread of Hep C, C, the spread of leukemia, or D, the spread of hepatitis A? What do you think it is? Okay. All right. So for this one says that they work dietary. So if they work dietary, that means that they're involved with touching food, right? So the only appropriate answer for that reason is going to be D, the spread of hepatitis A. So hepatitis A is spread through contamination, especially with like feces and food and water. That's the correct answer when it comes to how hepatitis A is spread. All the other choices is not typically the way that um, does not match with what that option is. All right. So that's the best answer. All right. Hopefully you were able to comment below or answer your question or post your answers before I went over the answer. Hopefully you found this easy. If you didn't find this easy, then it may be a sign that you need to spend a little bit more time with reviewing your content and questions. So if you click below this video, I do have this guide once again that you can check out and download for free. And then also you can click below to access some of our resources, including our course or our question bank, which will help you to better prepare for your exam so you can think more critically and pass your exam. Simply comment below, like, follow, and subscribe, and we'll see you the next time.